Okay, so people are starting to file in, and they'll just be connecting their sound. So just for if anybody can hear me at this point, we're just waiting for people to file in, so we'll get going in just 2 minutes. It's always a little awkward when you hear these things, you join these things and there's no one talking and you think, oh God, is it working? Is it happening?
It's true.
People file in, which is great. Just to let everyone know that we'll be starting in just 1 minute or 30 seconds as other people join us. Okay, I think a few more people may join us. It's just 2 minutes past 12:30, so I am going to get started, and other people can join us as they arrive. So good afternoon, everyone. My name is Lara Kroll, and I'm the Senior Manager of Policy Partnerships and Workforce Development here at BC Care Providers Association. I'd like to welcome you to today's webinar, which is focused on Healthmatch BC and Choose to Care, and how they are reducing barriers to recruitment for healthcare assistants. You're going to learn all about the great work that is being done with Andreanne and the Choose to Care team, as well as the supports that are available to financially support care aids at different stages of their registration and employment process. Before we do get started, I would like to acknowledge that we're gathered on the ancestral and unceded territories of the First Nations, Inuit, and Métis peoples across British Columbia. We would like to thank them for being good caretakers of the land and allowing us to be visitors on this shared territory and to host this dialogue here today. I, in particular, am thankful to be living, working, and learning on the land of the Coast Salish peoples, including the Squamish, the Musqueam, and the Tsleil-Waututh nations. If there are other territories that you would like to acknowledge, I would invite you to do that through the chat function. In terms of housekeeping items, you will notice that we are using Zoom webinar, which means that your cameras are off and you're muted automatically. If you'd like to ask a question throughout the presentation, I encourage you to do so through the Q&A function, and I will direct those questions to Andreanne at the end of the presentation, or I may pop in here and there if something is really timely. Please do note that we are recording the session today, and that recording will be made available to all delegates after the event. And in the same way, we are going to also make the slide deck available afterwards. So don't feel that you need to take screenshots of the slides. Everything will be provided. And on that note, I'm pleased to introduce Andreanne Gariepy of Healthmatch BC. Andreanne leads the team that supports future healthcare assistants in navigating the healthcare system to achieve their employment goals. Andreanne is a really great partner for us here at BC Care Providers. She's a great contact to have. She's always really willing and interested in answering my annoying questions and the rumors that pop up. And I'm really happy to have her here today just to provide some information and make everyone aware of the wonderful supports that are available through this program. So without further ado, I'm going to turn it over to you, Andreanne, and I will turn off my video and I will pop on periodically to address questions.
Awesome, thank you. Thanks, Lara, for the warm introduction. So yes, my name is Andreanne. I'm the official title, I guess, Senior Consultant of the Healthcare Assistant team at Healthmatch BC. And I started with Healthmatch back in May 2019 to lead the HCA portfolio. I also would like to begin by acknowledging that we are fortunate to be able to gather today on the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm very excited to be here today to deliver this lunch and learn and hopefully give you some more insights about the HCA registration pathways and the supports available through Healthmatch, and also maybe have an opportunity to ask questions at the end. So without further ado, I will start if I can. So the agenda, I'll start by introducing you to the Choose to Care program for those that might not know us. I'll briefly touch on the BC Care Aid and Community Health Worker Registry, or the registry for short. I'll go through a few of the HCA registration pathways and talk about the financial supports available through Healthmatch BC for those pathways. I'll mention some other financial supports available outside of Healthmatch BC, and then we'll open it up to questions. So the Choose to Care program is a program under Healthmatch BC, which is a division of the Health Employers Association of BC, or HEABC. The program launched in 2019 through a partnership with the provincial government, employers, educators, and industry associations. The purpose of the program is to increase public awareness of the healthcare assistant profession and to provide potential HCAs with information they need to train, register, and become employed in BC. We are funded by the BC government, specifically the Ministry of Health. And we started as a team of 2, and now we've grown to a strong team of 6, just given the increase in initiatives that is under our portfolio. I just wanted to mention the Choose to Care website, which is up here. One of the intentions of the website is to tackle any myths and misconceptions about working as an HCA. It's a great resource for any of you or your staff or anybody you know who's interested in joining the HCA profession. And I also want to just put a plug in that we are in the midst of revamping the Choose to Care website with updated information as well as just a better user experience. So we're really excited to be launching that later this month. There are custom landing pages on the website with specific information for different groups like youth, internationally educated healthcare professionals, nursing students, adult learners, and basically the initiative of the Choose to Care is to tackle several barriers faced by applicants. So access to relevant or accurate information, myth busting, financial costs associated with certain requirements to register as an HCA, as well as financial costs associated with the Health Career Access Program, or HCAP. The BC Care Aid Community and Community Health Worker Registry, I'm sure most of you, if not all of you, are aware of them. I'll just call it the registry for short. They were established in January 2010. And their mandate is threefold. First, to protect vulnerable patients, residents, and clients. Second, to establish and improve standards of care in the care aid and community health worker occupations. And thirdly, to promote professional development for care aides and community health workers, and to assist these workers in identifying career opportunities. As you may know, to be eligible to work as an HCA in any publicly funded healthcare setting, HCAs must be registered with the registry. And the registry, just to give you a sense, it's a subdivision of HEABC, and our team works really closely with this group as we're helping individuals navigate the registration process. So here are some of the main HCA registration pathways that we help our clients navigate. This isn't an exhaustive list. If you want a list of all the registration pathways, I recommend that you go on the registry website. So I'll go through these one by one. The first one here is completing a recognized HCA program in BC. So that's an option that's available to anybody. There are about 38 recognized schools that offer this program across British Columbia. For a list, you can go on our Choose to Care website on the education page or on the registry website as well. The program takes on average 7 months, but can range between 7 and 12 months. And the tuition ranges between $4,000 and $8,000, depending on the school. So the process, as you can see here, is completing an HCA program. Once they're done, they submit an application to the registry and include one of these documents just to show proof that they've completed training. And then if everything looks good, within 5 business days, they will get their registry number. There are no financial supports through HMBC or Healthmatch BC available for this pathway, but there are, student loans, low interest loans, foreign credential loans that I'll mention a little bit later. And also, I should add that there are a lot of fully funded programs across the province for those who are working with Work BC or attached to EI. This pathway is called the HCA Competency Assessment Pathway, and it's available for internationally educated healthcare professionals. Lots of people in this group are IENs, or internationally educated nurses, that come to British Columbia, and while they're working on their registered nursing licensure, they will register as an HCA to work in the healthcare system. It could also be available to graduates of HCA programs outside of Canada, or graduates of HCA programs within Canada but outside of BC, who don't qualify for the expedited registration pathway that I'll go through after. So as you can see, for this pathway, applicants need to submit an initial application to the registry, including credential evaluation from their home country or their home province, and English language skills if they do not meet the standards. Once they have been determined as qualified by the registry, they will be referred to the Nursing Community Assessment Service, or for short, NCAS, for a competency-based assessment that assesses the potential HCAs on all HCA competencies. And then NCAS, as contacts them to schedule their assessments. They complete the components, which includes a computer-based assessment and a simulation lab assessment, which are both delivered in Vancouver. And then once they complete, the registry sees the report, and then if there's any undemonstrated competencies, they will be referred to some refresher courses as a final step to this pathway. So the time to complete the pathway really depends on the individual. It can vary depending on many factors, like the initial requirements, like the credential evaluation, getting these requirements into the registry, as well as potential wait times to book assessments or education courses. Although I will say that currently NCAS only has a wait time of 2 to 3 weeks, which is very good. So dependent on all of that, it could take as little as 4 months and up to a year for applicants. And the fees, the costs associated with this pathway are the fees for NCAS, and then any, study materials and tuition for any required education. So this is the longest standing bursary program that we have at Healthmatch. So individuals who are referred to complete NCAS by the registry are offered an opportunity to connect with our team to discuss their eligibility for these bursaries. So our team completes a consultation call with each person, and then we provide them with information about the registration pathway, like what to expect, next steps. A lot of them might be feeling a bit anxious or apprehensive about the process, so that really helps them. And then we sign a bursary agreement that confirms that they're eligible to receive funding once they've completed the assessments. And then we also provide some information and support for employment while they're completing their registration process. Many people don't know that they can work in support services roles within healthcare, like housekeeper or a private caregiver. So just going through the actual financial supports here, the NCAS bursary is up to $2,000, and the actual assessment costs $2,000. And for individuals that need to travel from outside the Lower Mainland to take NCAS, we also have a rural allowance that ranges from $750 to $1,000. And it's based on the distance between the applicant's primary residence to the NCAS site at Langara. And then if they are referred to additional education courses, we will connect with them again and guide them through, which schools they can attend to complete those courses, and complete another bursary agreement with the remedial bursary, which is between $150 to $1,500, so proportionate to the cost of the courses they're referred to. And I don't have it on this slide, I just realized, but we just launched remedial rural travel allowance. There are some courses that sometimes have an in-person component that are not available at each school across the province. So working with the applicants, we can also offer some additional funding there if they need to travel and find accommodation to complete that course. And then finally, once they're registered, we do invite them to connect with us again to offer some guidance with their job search. So the expedited pathway or registration pathway is for graduates of a Canadian HCA or equivalent program that's in good standing with the Ministry of Advanced Education or equivalent in the originating Canadian territory or province, and who can provide evidence of recent HCA experience. So the pathway takes approximately 1 month. It really depends on the time the applicant takes to complete the online modules. So as you can see here, the applicants submit their application to the registry, and then the registry will supply instructions on how to complete a 12-hour HCA standardized orientation program, which is online and self-paced. And then once they can provide proof of having completed that program to the registry, they will become registered HCAs. So for this pathway, there are no direct costs except for the time that the applicants take to complete the HCA standardized orientation. So we do have available the expedited pathway stipend for applicants who qualify for this pathway. They must be registered and they must be employed as HCAs in BC. And the stipend is $250 to compensate them for their time to complete the orientation modules. This one I'm sure everybody has heard about in the last months here, the Health Career Access Program, or HCAP. So this is a new pathway that was announced by the ministry, I think back in January, and the process is here. So people who are interested would submit an expression of interest, and people who are eligible for this pathway is essentially anybody with a grade 10 education or equivalent who meet standard English language competency requirements. So very low barrier. And then health employers that are participating in this program will identify which applicants they want to extend offers to depending on their hiring needs. So that's kind of key. There is no guarantee of employment when submitting expression of interest to HCAP. But once they're employed, they complete basic training and onboarding with that employer, and then they work as a healthcare support worker, HCSW, while they receive education and training to essentially become a healthcare assistant. So this pathway takes approximately 12 months or a year, and there are no costs to enroll in HCAP. BC government really wanted this program to be low barrier and fully funded by the province. Having said that, there are costs associated with the prerequisite requirements to work as an HCSW. And so I'll talk about that next. I just wanted to mention that currently the submissions for HCAP are temporarily closed. So eligible employers are going through existing applicants in the system right now. So the HCAP prerequisite stipend is what we administer here at Healthmatch. As I was saying, to meet the eligibility requirements for the HCSW position under HCAP, applicants are required to complete a number of prerequisite courses. They may vary, but most of the time include food safe, standard first aid, and CPR. And if applicants don't meet the standard English requirements, an English language proficiency test. So once they've been accepted to HCAP and they've been hired as HCSWs, the stipend is available to them. It's a fixed amount of $342 to help them with any costs they've incurred through the process. And then additional funding is available for those who need to complete the English language testing. Last but not least, we have most recently implemented the HCA recruitment incentive. And this incentive became available for applicants who started in a recognized BC-based HCA program between January 1st, 2020 and March 31st, 2021. To be eligible, they have to provide proof of having graduated from this program, proof of employment as an HCA in an eligible healthcare sector. And then once they've met the eligibility criteria, they will receive a 12-month return of service agreement. And this agreement is between the HCA, participating HCA, and the Ministry of Health, and is basically says that they will be working as an HCA or equivalent in BC for the next 12 months. And casual and regular employees are eligible for this. And the current deadline to apply is January 31st, 2022. Yeah, that's what I'll say about that. So if you know anybody, I mean, the deadline is coming up here. So share this information with them. I just have a summary here of all the financial supports offered through Healthmatch. So this is why our team has grown. And it's in a chronological order. So first we started with the HCA Competency bursaries when Choose to Care initially launched in September 2019. And then the expedited pathway stipend became available in October 2020. And more recently, HCAP prerequisite stipends became available in February, and the HCA recruitment incentive in April. And on our new website, all of this information will be accessible in one place. So we're really excited about that. I did want to show a program video that we created with internationally educated healthcare professionals who went through the NHCAS Competency Assessment pathway and were supported through our bursary program, and just talks about their experience, why they like working as HCAs, what kind of characteristics makes a good HCA, and about their journey to becoming registered HCAs. And they're all working as registered HCAs now. I'll just hit play here. Oops. I will try to hit play. Give me 1 second.
Uh-oh, as I suspected, Andreanne, unfortunately, we can't hear the sound on the video.
Okay. Okay. Well, I guess we won't show the video. It will be in the slides maybe, or I can include the link as well.
Maybe let's include the link. Sorry about that. We should have tested that in our.
You should have tested that. Yeah, we didn't think about that. I kind of had a feeling too, and I was like, okay. Thanks for letting me know. Well, this lovely program video will be accessible to you for watching. We're pretty excited about it. We didn't have a video like that before, like professionally made. And I think a lot of applicants that we get definitely can relate to people in this video, which encourages them to reach out. And especially as our program is, somewhat new, some people aren't aware of it. So all of these tools are helpful to get more people helped with the bursary program. I'll just mention quickly some financial supports available outside of Healthmatch BC. So you may already know about the Career Paths for Skilled Immigrants program through Douglas College. Their program is available for newcomers living in any BC community that have previous training and skills as an HCA, nurse, physician, sonographer from a foreign country. And to be eligible, they need to be a permanent resident in BC for 5 years or less and not have received EI for 5 years or less. CERB from COVID is an exception to that. So their team of career coaches work with clients on a one-on-one basis and offer, you know, guidance, information. They also have some workshops to help prepare for NCAS, for example, and some financial supports for expenses related to their licensure. We work really closely with their team, and we do exchange clients or, you know, refer clients across programs. Lots of IENs or internationally educated nurses that work with us for their HCA registration will work with them for their registered nursing licensure. And then, as I mentioned before, there are other financial supports available for applicants depending on eligibility, including student loans, microloans, many that are available for newcomers and skilled immigrants, especially. Like windmill microlending is one. Foreign credential loans available through banks. And we have many of these financial supports available on our website, on the Choose to Care website. And last but not least, we do encourage you to follow us on, the Choose to Care social media channels. We're on Instagram, Facebook, and Twitter. We often retweet content from the BC Care Providers Association. And then you can also encourage anybody you know or staff to connect with us directly. Lots of information on the Choose to Care website, especially when it will be launched with the new information, but they can also contact us directly at info@choosetocare.ca. That takes me to the end of the presentation. If we want to open it up for questions.
Yeah, great. There are questions. Yeah, don't worry, there are questions. Yeah, thank you so much for the presentation, and thank you so much for all of the information. I did put a link to Douglas College's Career Paths for Skilled Immigrants program into the chat function, so people can visit that website to learn more about it. One of the questions that comes to mind for me is you're talking about your website refresh, which is fantastic. How do you think the content on the website is going to change or develop in response to COVID? Is the messaging changing? Is it talking about, become a healthcare hero in the times of a pandemic? Just wondering what we can expect in terms of the updates.
Good question. Definitely something that we've discussed with our marketing agency, our marketing team. Imagery, the video, we didn't see it, but it was actually shot during COVID, and there is one person that is wearing her mask, like one of the HCAs. It was actually a personal choice, but having a balance of that in imagery is good to show the reality of what it's like right now. And probably for the foreseeable future. Our website is, to provide information about training, how to register, and employment, not so much like information about, vaccination requirements and all of those things. So that's not something that's going to be part of the Choose to Care website. Other than that, there definitely has been some social media posts about healthcare heroes when not anymore, but like last quarter or the previous 2 quarters. Yeah, that's pretty much it, like in terms of COVID relevant information.
Yeah, I guess I would love to see some of the messaging develop to reflect the changing times. It is good to know that the vaccination information won't be available through the website. Obviously, that's a really key piece when we're talking to people about careers in healthcare these days. I do encourage the delegates to put questions into the Q&A function. I'm going to go to the first one that I have here, and as a student of you, Andreanne, I have a bunch of questions as well. So I suspect that this actually might be a question for the registry, so we might have to follow up. But the question is, what percentage of the HCA competency assessment applicants to date have been successful in meeting all the identified requirements necessary to be granted their Care Aid Registry number?
Yeah, that's definitely a question for the registry. Our role is to help those people navigate the registration pathway, but we don't collect data on that. I can say though that we have helped hundreds of applicants through that pathway since the launch of our bursary program in 2019.
Okay, that's helpful context. And maybe if that is information that our members are interested in, we can look into hosting a follow-up webinar perhaps with the registry. So we'll keep that on file. One of the questions that I have, and in particular, one of the reasons that I wanted to host this webinar today is every once in a while, someone will, pop into my inbox with a rumor or often some misinformation. And one of the ones that came across my desk was about the HCA, or the NHCS bursary, sorry.
Okay.
And, someone said to me, if the worker doesn't pass the NHCS, quote unquote, pass, they're not eligible for the bursary. I'm wondering if you can kind of maybe address that piece.
Yeah, that's a good question, and I could have expanded on that for sure. So the NHCAS assessment, first of all, is not really a pass or fail. It's a one-time assessment that people take to assess their HCA competencies. So the result will show competencies that were completely demonstrated and some that were partially or undemonstrated. So if, no matter what their result is, they will be eligible for the NHCAS bursary. So they will get reimbursement for that. And then the outcome will just determine the next steps, if they're required to take additional education and how much education, which education. Yeah.
And so just to clarify, regardless of their performance on the NHCAS, they would be eligible for the bursary. It's not, if they don't quote unquote pass, they're going to be ineligible.
Yes. Our intention is that they do complete the full pathway, like by offering them the NHCAS bursary and the remedial bursary. Yeah.
Okay, great. I was just attempting to address a question in the chat. Someone is asking whether this recording will be available to frontline caregivers, and the answer is yes, we can definitely make that available. Yeah, so one of the other questions that I have, I'm mindful of the fact that we have a number of employers on this call from various subsectors within our membership. I'm wondering about the type of employer and if it matters at all. We have members within our sector which are publicly subsidized long-term care. We have assisted living folks which have both private pay and publicly subsidized beds, and then we also have some of those smaller private pay home support organizations within our membership. So does the type of employer matter in terms of accessing this funding? Can their employees or job candidates access these supports that you've outlined here today?
Yeah, all of them. So the HCA competency assessment pathway, for sure. I mean, they wouldn't be registered yet, I guess, but maybe they're working as a housekeeper. I've heard this before, and then the employer wants to support them through the NHCAS assessment pathway. The employer is irrelevant really for that pathway. The expedited registration pathway as well, they can be employed as long as they're employed as an HCA in BC. The healthcare sector is irrelevant. I'm just trying to think of all the, so the HCAP prerequisite stipend obviously is for applicants that are enrolled in HCAP. So that, I mean, it's not really for the employers, but it's whatever employers are participating in HCAP, which my understanding is it includes people, members of the BC Care Providers Association. And then the HCA recruitment incentive is for eligible healthcare sectors, which includes health authority owned affiliate or private long-term care settings, health authority owned an affiliate or private assisted living, and then health authority owned home support and community support. So those are the eligible healthcare sectors for that one.
Okay, I think that piece is really helpful to clarify for our members who, again, are coming from a really diverse cross-section of the sector. One of the questions that came through in particular as it relates to the healthcare recruitment stipend, and I believe this is a member who is referring to candidates that they paid for them to go through the healthcare assistant training through the employer job grant. So basically the students did not have to pay any tuition for themselves.
Yeah.
And they're wondering if those care aids are eligible for the recruitment stipend.
Just to clarify, it's the HCA recruitment incentive, the $5,000.
Yes,
incentive?
sorry, the recruitment,
Yeah.
The $5,000. Yes, yeah. I'm getting them.
And that's a good point. I didn't even mention it was $5,000. So yeah, $5,000. Yes, they are. It's not a tuition reimbursement, it's a recruitment incentive. And yeah, the idea is to, have people work as HCAs in BC for 12 months. So it doesn't really matter how they paid for their tuition through a grant or whatnot, they would be eligible.
Okay, I think that's really great. BC Care Providers, for example, we have a number of students that we administer supports to, and we've been letting them know, hey, you're eligible for this stipend, even though you didn't pay tuition. So I think it's really great for our employers to be able to take that message out as well, if they have paid for students to go through the program. One of the pieces that I did see this on your slides, but you went over it a little quickly. When it comes to that $5,000, can you clarify who the return of service is to?
Yeah, so the return of service agreement is between the participating HCA and the Ministry of Health, so with the province. And then the applicant will provide like a notification letter to their employer, saying that they've entered this 12-month of return of service agreement with the province. The applicants don't need to remain with the same employer, but if they change employers or if they go on extended leave for any reason or anything like that, they do need to notify the ministry. And then at the end of the 12-month return of service, the employers do need to provide the applicants with a letter confirming that they've completed their agreement.
Thank you for clarifying that piece,
Yeah.
Because I know that has been a point of some misinformation. So I'm seeing another question coming through the chat, and I think I might tweak it a little bit. So they're asking about the materials or information that's available to high school graduates or high school students that may be interested in these careers. I'm wondering if you can talk a little bit more about the information that is available through the Choose to Care website, or maybe coming up with a website refresh that's relevant to that target demographic.
Yeah, I mean, there is a page on our website that is what is a healthcare assistant, which I think is very informative. And our marketing team helped us to do like a motion graphics video that's pretty short and really was like the hope was to target youth with that motion graphics video. Talks about, the different settings, just the basics, characteristics, pay, all of that. And then on the youth page specifically, it talks about the dual credit options that some schools offer, that they can start basically working towards HCA credentials while still in high school. So there's a video about that as well, I believe from Okanagan College, I can't remember. And then there's also some resources just about like healthcare system in general. Like if you start working as a healthcare assistant, you could also continue and working in other professions, how it's a good, it could be a good entry point into healthcare. Some youth respond well to that when they're not sure what field or industry like to go into. It's not, a 4-year bachelor's degree to start working, and they can just, try it out. I've gone to a couple of conferences and with youth, and they do respond well to that. And then there are some resources for parents and career counselors as well, like Career Navigator, like how to help youth choose the right profession for them, things like that. That's what I can remember off the top of my head. And financial supports, yeah, student loans and that.
Great, thank you. I know that getting more young people involved in these careers is something that's kind of top of mind for our members. So it's really wonderful that there are resources, particularly contained within the Choose to Care campaign, focused on these younger people. Okay, so one of the questions that came through, which again, I think it may not necessarily be a question for you, but it is perhaps something that I can follow up on. So the question coming through is, any idea when HCAP applications will be opened up again? Any ideas, or should I follow up on that one?
Yeah, good question. No, I mean, it's a ministry-led initiative, so it's not you know, it's not us who manages that. Yeah.
Okay, so I'll make a note of that question and follow up on that in my work. One of the other questions that is coming through is about the expedited HCA pathway, specifically the one for people that are trained as care aides in Canada, but within other provinces. And it sounds like there's a little bit of confusion about when a care aide is eligible for this pathway, or you know, when they might not be eligible and have to go through the more traditional competency assessment pathway. I'm wondering if you can expand a little bit on that one, or you know, maybe just who would be the best person to get in contact with if you're a little bit confused about whether you're eligible for that pathway.
I mean, I would say the registry, like the registry always encourages, if it's an applicant, like just apply, and then we'll direct you to, like the registry will direct them to the pathway that they're eligible for. So that's, I know, is something they always say on their website. It is very well laid out, like the expedited pathway. Well, the category is graduates of an HCA program in Canada, but you know, outside BC. And there are two options there. So option one is expedited pathway stipend, and option two is the HCA competency assessment, the NCAS pathway. For the expedited pathway, I don't have all the numbers like in front of me, but it is all there on the website. They do have to provide proof of their training, HCA or equivalent program from a Canadian province or territory. And then they have to provide proof of recent HCA work practice or work experience by having a nurse manager, or I think it's a nurse supervisor, provide a letter saying, like, confirming that they have that recent experience. So that's sometimes maybe a confusion, but I know registry just encourages applicants to apply.
Yeah, I think that's really helpful. Just apply, and then the registry staff will help direct you from there. I know that in the past, there's been some folks that, you know, thought they were eligible for the pathway, but didn't have that recent relevant experience, or perhaps their education was from, you know, something like 20 years ago, and, you know, there are certain time and criteria available are required for that piece. So it looks like we're coming to the end of the questions here, although we do have a few more minutes. So if you do have more questions, please pop them into the Q&A function. I'm just scrolling through to make sure that I'm not missing anything.
Because I had accounted for the 6-minute video.
Yes, we can definitely circulate that with the slide deck and the video afterwards, so people have an opportunity to take a look at that one. Yeah, maybe just, I know that a lot of the questions that were asked here today were perhaps relevant for the BC Care Aid Registry, for example. If folks on the line have you know, questions for that entity, is there a best way to get in contact with the registry?
I mean, they do have a email address on their website. I don't have it like off the top of my head. Like, I think it's register@cachw.com or .ca, but best is to go on the website on the contact us page. Yeah, I mean, I can pass it along as well to someone who works there. So you could send it to me, and then they will follow up from there.
Okay, that's great. And that probably leads me into my last question, which is if individuals on the line here have questions for you, Andreanne, following this, what is the best way to get in contact with you?
By email. So you can definitely circulate my email. I wouldn't really share my personal email with like all of your staff or anything like that. Probably the best for that is the info@choose2care email. Yeah, for the folks on the line, yeah, that's fine.
Okay, great. So not seeing any further questions come through. Oh, actually I am, I lie. So Carolina asked, will you be developing an informational cheat sheet for this that we can email to our caregivers? Great question.
To caregivers who are
interested the workers themselves.
Yeah, that's a really good idea. We have something like that, but maybe I can get marketing to help me make it pretty, and then could send it off. I don't know about like we don't have one right now, so I don't know about timeline, but it's a good idea for us to create that. So
okay, great.
Stay tuned.
Always good when you come away with homework from doing one of these webinars.
Yes.
Okay, thank you so much, Carolina, for that question. Not seeing any other questions. So I think what I'll do is just thank you so much for coming and talking about these wonderful supports that are available. Thank you very much for to the delegates that attended here today, and just have a great rest of your afternoon.
Yeah, thank you, everyone. Thank you, BC Care Providers, for offering this opportunity.
Wonderful. All right. Yeah, thank you, everyone. You can't see me, I'm waving. Bye now.